The PM's come out this morning calling for restrictions to be eased ASAP, also citing New South Wales. The whole city isn't locked down, but when they've handled similar outbreaks, they've just locked down certain areas. I guess what's your response?
Look, no one's handled similar outbreaks. Outbreaks previously across the country have either been single cases who've had some community exposures where we've seen circuit breaker lockdowns. So it's not to say they haven't occurred. They've occurred a couple of times in Perth, a couple of times in Brisbane with single cases or just a couple of cases. And previous outbreaks in Victoria have been handled without lockdowns. They've been handled through contact tracing, and the Blackrock outbreak is an example of that. And there were other transmissions, Park Royal and during the Australian Open in hotel quarantine, where we just followed up the exposure sites and the testing of community members who were primary close contacts for those sites. We are dealing with a variant of concern. Again, I don't want to say that it is some order of magnitude more dangerous, but 75% of people within households becoming positive when there's a case there is a challenge. And over a 5-day period, seeing a West Melbourne family of 4 go to another family of 4, going to a teacher, going to a workplace, and to that family over 5 days, 3-4 transmissions, is a pretty rapidly moving leading edge. That's not the serial interval for all transmissions for that virus, but it does mean that we are racing against the clock, and it is a testament to contact tracing that not only are those primary close contacts, but the contacts of contacts are being isolated, quarantined at home, well ahead of those thresholds that the Finkel review laid out. And I think, the Finkel review was really important in telling us the benchmarks that we need to hit in order to make sure that we can get ahead of the spread of this virus. I do reflect on the fact that that leading edge of infections is even faster than some of those benchmarks, and that's why it's great that we're exceeding those really significantly, that we're completing interviews within hours of a case being notified, and that the primary and secondary close contacts are quarantining. But to answer your question, the getting your arms around this does require a really rapid movement to isolate and quarantine everyone involved.
Just following on from that question, sorry, there's also been suggestions about a targeted approach of lockdown moving forward, so allowing other areas to reopen and just locking down those areas of concern. Would you consider that moving forward?
Look, yeah, we consider all options. It's fair to say we've got 300 exposure sites across metropolitan Melbourne. They're very broadly spread. We know those primary close contacts, but we've still seen some mystery cases, some cases where we don't know where they've acquired it across Metro Melbourne. And of course, we're differentiating regional and Metro Victoria. We'll continue to review in light of the activity that we see over the next couple of days.
Within Melbourne, there's been certain precincts, so it's either been the northwest or west, so there's parts that might be, 50 kilometres away. Would you consider allowing those parts to reopen, or are we going to go for the blanket approach?
Nothing on or off the table, but we do recognise that there are significant movements of people across Melbourne for essential work purposes, for other essential reasons. So we can't discount the significant movement across Metro Melbourne either.